ANCC PMHNP certification exam. Question 1. Which neurotransmitter is primarily implicated in the reward pathway and the development of substance use disorders? Option A, serotonin. Option B, GABA. Option C, dopamine. Option D, glutamate. The correct answer is option C, dopamine. Dopamine release in the nucleus accumbens is the primary driver of the brain's reward system and reinforcement of addictive behaviors. Question 2. A patient on clozapine, Clozaril, must have regular monitoring of which lab value due to the risk of a granulocytosis? Option A, serum creatinine. Option B, absolute neutrophil count, ANC. Option C, liver function tests, LFTs. Option D, thyroid stimulating hormone, TSH. The correct answer is option B, absolute neutrophil count, ANC. Clozapine has a black box warning for a granulocytosis, requiring strict ANC monitoring via the clozapine REMS program. Question 3. According to Erickson, which psychosocial stage is a 75-year-old patient navigating? Option A, generativity versus stagnation. Option B, integrity versus despair. Option C, identity versus role confusion. Option D, intimacy versus isolation. The correct answer is option B, integrity versus despair. Late adulthood, 65 plus, involves reflecting on one's life to achieve a sense of integrity rather than despair over perceived failures. Question 4. Which brain structure is primarily responsible for the fear response and emotional processing? Option A, hippocampus. Option B, prefrontal cortex. Option C, amygdala. Option D, basal ganglia. The correct answer is option C, amygdala. The amygdala acts as the brain's alarm system, triggering the fight-or-flight response in the presence of perceived threats. Question 5. What is the gold standard pharmacological treatment for bipolar I disorder involving classic mania? Option A, lamotrigine. Option B, lithium. Option C, fluoxetine. Option D, quetiapine. The correct answer is option B, lithium. Lithium remains the first-line treatment for acute mania and maintenance of bipolar I disorder, particularly for preventing suicide. Question 6. Which legal concept refers to a PMHNP's duty to warn a third party of a potential threat from a patient? Option A, Nacton Rule. Option B, Tarasoff Principle. Option C, Durham Rule. Option D, Habeas Corpus. The correct answer is option B, Tarasoff Principle. The Tarasoff duty to warn requires clinicians to breach confidentiality if a patient poses a specific, identifiable threat to a third party. Question 7. A patient presents with waxy flexibility and mutism. Which subtype of schizophrenia or specifier is this? Option A, paranoid. Option B, disorganized. Option C, catatonic. Option D, residual. The correct answer is option C, catatonic. Catatonia involves motor immobility or excessive motor activity, often including purposeless movement or waxy flexibility. Question 8. Which antidepressant is most likely to cause hypertensive crisis if taken with tyramine-rich foods? Option A, sertraline. Option B, venlafaxine. Option C, phenelzyne, MAOI. Option D, bupropion. The correct answer is option C, phenelzyne, MAOI. MAOIs inhibit the breakdown of tyramine, which can lead to a dangerous increase in blood pressure if tyramine is ingested. Question 9. What is the primary mechanism of action of benzodiazepines? Option A, dopamine antagonism. Option B, serotonin reuptake inhibition. Option C, potentiation of GABA receptors. Option D, NMDA receptor antagonism. The correct answer is option C, potentiation of GABA receptors. Benzodiazepines enhance the effect of GABA, the brain's primary inhibitory neurotransmitter, resulting in anxiolytic and sedative effects. Question 10. A PMHNP is using motivational interviewing for a patient with alcohol use disorder. What is the focus of the evoking stage? Option A, establishing a connection. Option B, identifying a specific agenda. Option C, eliciting the patient's own motivations for change. Option D, providing expert advice. The correct answer is option C, eliciting the patient's own motivations for change. Evoking involves drawing out change talk from the patient rather than the clinician imposing reasons for change. Question 11. Which metabolic side effect is of greatest concern with atypical antipsychotics, SGAs, like olanzapine? Option A. Hypothyroidism. Option B. Weight gain and dyslipidemia. Option C. Nephrotoxicity. Option D. Otitis media. The correct answer is option B. Weight gain and dyslipidemia. SGAs carry a high risk for metabolic syndrome, including significant weight gain, insulin resistance, and elevated cholesterol. Question 12. A child with ADHD is started on methylphenidate. What are the most common side effects to monitor? Option A. Weight gain and sedation. Option B. Insomnia and decreased appetite. Option C. Leukopenia and rash. Option D. Hyperglycemia and thirst. The correct answer is option B. Insomnia and decreased appetite. Stimulants commonly cause appetite suppression and difficulty falling asleep. Question 13. What is the therapeutic serum level for lithium in most maintenance patients? Option A. 0.1 to 0.5 milliequivalent/L. Option B. 0.6 to 1.2 milliequivalent/L. Option C. 1.5 to 2.0 milliequivalent/L. Option D. 2.5 to 3.0 milliequivalent/L. The correct answer is option B. 0.6 to 1.2 milliequivalent/L. The standard maintenance range is 0.6 to 1.2 milliequivalent/L. Levels above 1.5 milliequivalent/L are considered toxic. Question 14. Which therapy model focuses on cognitive distortions and automatic thoughts? Option A. Dialectical behavior therapy, DBT. Option B. Interpersonal therapy, IPT. Option C. Cognitive behavioral therapy, CBT. Option D. Solution-focused therapy. The correct answer is option C. Cognitive behavioral therapy, CBT. CBT focuses on the link between thoughts, feelings, and behaviors, aiming to correct irrational thought patterns. Question 15. A patient reports sudden onset of muscle stiffness, high fever, and altered mental status after an antipsychotic dose. This suggests option A. Serotonin syndrome. Option B. Neuroleptic malignant syndrome, NMS. Option C. Agranulocytosis. Option D. Akathisia. The correct answer is option B. Neuroleptic malignant syndrome, NMS. NMS is a life-threatening reaction to antipsychotics characterized by lead pipe rigidity, hyperpyrexia, and autonomic instability. Question 16. What is the primary difference between bipolar I and bipolar II disorder? Option A. Bipolar I requires at least one manic episode. Bipolar II requires hypomania and depression. Option B. Bipolar II is more severe than bipolar I. Option C. Bipolar I does not involve depression. Option D. Bipolar II requires psychosis. The correct answer is option A. Bipolar I requires at least one manic episode. Bipolar II requires hypomania and depression. Bipolar I is defined by full mania, which may include psychosis/hospitalization, while bipolar II is defined by hypomania. Question 17. Which class of medications is the first-line treatment for obsessive-compulsive disorder, OCD? Option A. Benzodiazepines. Option B. Stimulants. Option C. SSRIs, often at higher doses. Option D. Antipsychotics. The correct answer is option C. SSRIs, often at higher doses. High-dose SSRI therapy is the pharmacological mainstay for OCD. Question 18. Scope of practice for a PMHNP is primarily determined by option A. The American Nurses Association, ANA. Option B. The State Board of Nursing/State Law. Option C. The hospital's medical director. Option D. The federal government. The correct answer is option B. The State Board of Nursing/State Law. While national organizations provide guidelines, legal scope is defined by the specific state's Nurse Practice Act. Question 19. Which area of the brain is associated with executive functioning, logic, and planning? Option A. Occipital lobe. Option B. Parietal lobe. Option C. Prefrontal cortex. Option D. Cerebellum. The correct answer is option C. Prefrontal cortex. The prefrontal cortex is the CEO of the brain, managing complex cognitive behavior and decision-making. Question 20. A patient on valproate, Depakote, should have which lab tests monitored periodically? Option A, CBC and LFTs. Option B, BUN and creatinine. Option C, TSH and T4. Option D, cardiac enzymes. The correct answer is option A, CBC and LFTs. Valproate can cause hepatotoxicity and thrombocytopenia, requiring monitoring of liver enzymes and platelets. Question 21. In dialectical behavior therapy, DBT, what is the core skill used to balance change and acceptance? Option A, free association. Option B, mindfulness. Option C, dream analysis. Option D, biofeedback. The correct answer is option B, mindfulness. Mindfulness is a core DBT skill used to help patients stay present and accept reality without judgment. Question 22. What is the first-line treatment for PTSD according to the VA/DoD guidelines? Option A, Valium. Option B, trauma-focused psychotherapy, like EMDR or CPT, and SSRIs/SNRIs. Option C, antipsychotics. Option D, electroconvulsive therapy, ECT. The correct answer is option B, trauma-focused psychotherapy, like EMDR or CPT, and SSRIs/SNRIs. Psychotherapy is the foundation of PTSD treatment, often supplemented by medications like sertraline or paroxetine. Question 23. Nihilistic delusions, believing the world or oneself doesn't exist, are most commonly seen in which condition? Option A, mild anxiety. Option B, severe depression with psychotic features, cotards. Option C, ADHD. Option D, anorexia nervosa. The correct answer is option B, severe depression with psychotic features, cotards. Nihilistic delusions are extreme forms of depressive psychosis. Question 24. Which neurotransmitter is excitatory and implicated in memory and learning? Option A, GABA. Option B, glycine. Option C, glutamate. Option D, melatonin. The correct answer is option C, glutamate. Glutamate is the brain's most abundant excitatory neurotransmitter. Excessive glutamate is linked to neurotoxicity. Question 25. A PMHNP is treating a pregnant woman with depression. Which SSRI is often avoided due to a potential risk of fetal cardiac septal defects? Option A, sertraline. Option B, fluoxetine. Option C, paroxetine, Paxil. Option D, escitalopram. The correct answer is option C, paroxetine, Paxil. Paroxetine is generally avoided in the first trimester due to its association with cardiovascular malformations. Question 26. Akathisia is best described as option A, involuntary muscle twitching. Option B, an internal sense of restlessness and an inability to sit still. Option C, muscle rigidity. Option D, slurred speech. The correct answer is option B, an internal sense of restlessness and an inability to sit still. Akathisia is a common and distressing extrapyramidal side effect, EPS, of antipsychotics. Question 27. Which defense mechanism involves attributing one's own unacceptable feelings to others? Option A, reaction formation. Option B, sublimation. Option C, projection. Option D, displacement. The correct answer is option C, projection. Projection is a common defense where a person denies their own traits by seeing them in someone else. Question 28. In the DSM-5-TR, how long must symptoms last for a diagnosis of major depressive disorder? Option A, 1 week. Option B, 2 weeks. Option C, 1 month. Option D, 6 months. The correct answer is option B, 2 weeks. A minimum of 2 weeks of depressed mood or anhedonia, plus other symptoms, is required for MDD. Question 29. What is the mechanism of action of atomoxetine, Strattera, for ADHD? Option A, dopamine stimulant. Option B, selective norepinephrine reuptake inhibitor, SNRI. Option C, alpha-2 agonist. Option D, GABA enhancer. The correct answer is option B, selective norepinephrine reuptake inhibitor, SNRI. Atomoxetine is a non-stimulant option for ADHD that increases norepinephrine in the prefrontal cortex. Question 30. A patient has a flat affect, poverty of speech, and social withdrawal. These are examples of option A, positive symptoms of schizophrenia. Option B, negative symptoms of schizophrenia. Option C, cognitive symptoms. Option D, manic symptoms. The correct answer is option B, negative symptoms of schizophrenia. Negative symptoms represent a loss of normal function and are often harder to treat than positive symptoms, delusions/hallucinations. Question 31. Which vitamin deficiency is common in patients with chronic alcohol use and can lead to Wernicke-Korsakoff syndrome? Option A, vitamin C. Option B, vitamin B1, thiamine. Option C, vitamin D. Option D, vitamin B12. The correct answer is option B, vitamin B1, thiamine. Thiamine deficiency leads to neurological damage in chronic alcoholism. Question 32. Transference in the therapeutic relationship is defined as: option A, the clinician's feelings toward the patient. Option B, the patient's displacement of feelings from a past relationship onto the clinician. Option C, giving the patient a ride home. Option D, the patient's refusal to talk. The correct answer is option B, the patient's displacement of feelings from a past relationship onto the clinician. Transference is a normal part of the therapeutic process where patients project past dynamics onto the therapist. Question 33. Which screening tool is most commonly used to assess for alcohol use disorder? Option A, PHQ-9. Option B, CAGE or audit. Option C, GAD-7. Option D, MDQ. The correct answer is option B, CAGE or audit. The CAGE, cut down, annoyed, guilty, eye-opener, is a rapid screening tool for alcohol issues. Question 34. A patient on lamotrigine, Lamictal, develops a blister-like rash on the trunk. What is the immediate priority? Option A, decrease the dose. Option B, apply hydrocortisone. Option C, stop the medication immediately and send to the ER. Option D, switch to a different manufacturer. The correct answer is option C, stop the medication immediately and send to the ER. The Lamictal rash can progress to Stevens-Johnson syndrome, SJS, which is a life-threatening dermatological emergency. Question 35. Primary prevention in mental health refers to: option A, treating a relapse. Option B, screening for depression in a primary care clinic. Option C, stress management education for school children to prevent future illness. Option D, rehabilitating a patient after a suicide attempt. The correct answer is option C, stress management education for school children to prevent future illness. Primary prevention focuses on preventing the initial onset of a disorder. Question 36. Which neurotransmitter is the inhibitory counterpart to glutamate? Option A, norepinephrine. Option B, dopamine. Option C, GABA. Option D, acetylcholine. The correct answer is option C, GABA. GABA, gamma-aminobutyric acid, reduces neuronal excitability throughout the nervous system. Question 37. A PMHNP is providing family therapy. Which theorist is known for systemic or structural family therapy? Option A, Sigmund Freud. Option B, Salvador Minuchin. Option C, B.F. Skinner. Option D, Jean Piaget. The correct answer is option B, Salvador Minuchin. Minuchin developed structural family therapy, focusing on boundaries and hierarchies within the family system. Question 38. What is the black box warning for all antidepressants in the pediatric and young adult population? Option A, risk of weight gain. Option B, risk of increased suicidal ideation and behavior. Option C, risk of heart failure. Option D, risk of liver failure. The correct answer is option B, risk of increased suicidal ideation and behavior. All antidepressants carry this warning for patients under age 24, requiring close monitoring during the start of treatment. Question 39. Which of the following is a symptom of serotonin syndrome, but not NMS? Option A, fever. Option B, confusion. Option C, hyperreflexia and myoclonus. Option D, tachycardia. The correct answer is option C, hyperreflexia and myoclonus. Serotonin syndrome typically involves hyperreactive reflexes, while NMS involves lead pipe rigidity. Question 40. A PMHNP is conducting a quality improvement project using the PDSA cycle. What does PDSA stand for? Option A, Practice Daily Safety Alert. Option B, Plan Do Study Act. Option C, Patient Doctor Specialist Assessment. Option D, Post-Discharge Safety Analysis. The correct answer is option B, Plan Do Study Act. PDSA is a standard model for testing changes and improving processes in healthcare. Question 41. Evidence-based practice, EBP, involves the integration of which three components? Option A, cost, time, and technology. Option B, research evidence, clinical expertise, and patient values. Option C, doctors, nurses, and patients. Option D, policy, law, and ethics. The correct answer is option B, research evidence, clinical expertise, and patient values. EBP ensures that clinical decisions are grounded in the best available science and the patient's preferences. Question 42. Which personality disorder is characterized by instability of relationships, fear of abandonment, and self-harm? Option A, narcissistic. Option B, borderline. Option C, antisocial. Option D, schizoid. The correct answer is option B, borderline. Borderline personality disorder, BPD, involves pervasive instability in moods, self-image, and behavior. Question 43. What is the Nacton rule related to? Option A, informed consent. Option B, the insanity defense in legal proceedings. Option C, the right to refuse treatment. Option D, the duty to report child abuse. The correct answer is option B, the insanity defense in legal proceedings. The Nacton rule determines whether a person was insane at the time of a crime and could distinguish right from wrong. Question 44. Which part of the brain is most affected in Alzheimer's disease, leading to memory loss? Option A, amygdala. Option B, hippocampus. Option C, thalamus. Option D, pons. The correct answer is option B, hippocampus. The hippocampus is critical for the formation of new memories and is one of the first areas damaged by Alzheimer's. Question 45. A patient taking lithium presents with slurred speech, ataxia, and gross tremors. This likely indicates option A, therapeutic effect. Option B, lithium toxicity. Option C, normal side effects. Option D, anxiety. The correct answer is option B, lithium toxicity. Ataxia, unsteadiness, and tremors are hallmarks of lithium toxicity. Question 46. Which legal document gives a person the right to make financial or medical decisions for another? Option A, HIPAA release. Option B, power of attorney, POA. Option C, professional boundary agreement. Option D, treatment plan. The correct answer is option B, power of attorney, POA. POA is a legal designation of authority to act on someone else's behalf. Question 47. Interpersonal therapy, IPT, is primarily used for which condition? Option A, schizophrenia. Option B, major depressive disorder, MDD. Option C, ADHD. Option D, alcoholism. The correct answer is option B, major depressive disorder, MDD. IPT focuses on improving relationships and social functioning to alleviate depressive symptoms. Question 48. Which class of medication is generally avoided in patients with a history of substance use disorder? Option A, SSRIs. Option B, atypical antipsychotics. Option C, benzodiazepines. Option D, mood stabilizers. The correct answer is option C, benzodiazepines. Benzodiazepines have a high potential for misuse, dependence, and withdrawal, making them high risk for this population. Question 49. What is health policy primarily concerned with? Option A, individual patient care plans. Option B, laws and regulations that govern the healthcare system and public health. Option C, the hospital's budget for furniture. Option D, writing prescriptions. The correct answer is option B, laws and regulations that govern the healthcare system and public health. Health policy impacts access, cost, and quality of care on a systemic level. Question 50. Which lab value is most critical to monitor for a patient on carbamazepine, Tegretol? Option A, serum calcium. Option B, CBC, specifically for a granulocytosis or aplastic anemia. Option C, urine protein. Option D, thyroid levels. The correct answer is option B, CBC, specifically for a granulocytosis or aplastic anemia. Carbamazepine carries a risk of serious blood dyscrasias. Question 51. Therapeutic communication includes which technique? Option A, giving advice. Option B, using silence and active listening. Option C, changing the subject. Option D, judging the patient. The correct answer is option B, using silence and active listening. Silence and active listening allow the patient to process their thoughts and feel heard. Question 52. Which of the following is a cluster B personality disorder, dramatic/erratic? Option A, paranoid. Option B, antisocial. Option C, obsessive-compulsive. Option D, avoidant. The correct answer is option B, antisocial. Cluster B includes antisocial, borderline, histrionic, and narcissistic personality disorders. Question 53. A PMHNP is evaluating a patient for bipolar I disorder. What is the MDQ? Option A, medical doctor questionnaire. Option B, mood disorder questionnaire. Option C, memory deficit quantifier. Option D, mental diagnostic query. The correct answer is option B, mood disorder questionnaire. The MDQ is a validated screening tool specifically for bipolar spectrum disorders. Question 54. Neuroplasticity is defined as, option A, the brain's inability to change. Option B, the brain's ability to reorganize and form new neural connections throughout life. Option C, the death of neurons. Option D, a type of brain surgery. The correct answer is option B, the brain's ability to reorganize and form new neural connections throughout life. Neuroplasticity is the foundation for learning, memory, and recovery from brain injury or mental illness. Question 55. Which of the following is a social determinant of health, SDOH? Option A, the patient's genotype. Option B, access to safe housing and stable employment. Option C, the patient's resting heart rate. Option D, the color of the hospital walls. The correct answer is option B, access to safe housing and stable employment. SDOH are conditions in the environments where people are born, live, learn, and work that affect health outcomes. Question 56. What is the cultural formulation interview, CFI, in the DSM-5 used for? Option A, to test IQ. Option B, to understand the patient's cultural perspective on their illness and symptoms. Option C, to determine citizenship. Option D, to bill the insurance company. The correct answer is option B, to understand the patient's cultural perspective on their illness and symptoms. The CFI helps clinicians provide culturally competent care by exploring the patient's personal background and values. Question 57. Which medication is an opioid antagonist used to prevent relapse in opioid and alcohol use disorders? Option A, methadone. Option B, buprenorphine. Option C, naltrexone. Option D, alprazolam. The correct answer is option C, naltrexone. Naltrexone blocks the euphoric effects of opioids and reduces cravings for alcohol. Question 58. Informed consent must include which of the following? Option A, a guarantee of a cure. Option B, risks, benefits, and alternatives to the proposed treatment. Option C, the nurse's phone number. Option D, the hospital's profit margin. The correct answer is option B, risks, benefits, and alternatives to the proposed treatment. Patients must be fully informed to provide ethical and legal consent for treatment. Question 59. What is telepsychiatry? Option A, a TV show about psychiatrists. Option B, the delivery of psychiatric services via telecommunications technology. Option C, a way to read minds. Option D, only for patients in jail. The correct answer is option B, the delivery of psychiatric services via telecommunications technology. Telepsychiatry increases access to mental health care for rural or underserved populations. Question 60. Which professional entity provides certification for PMHNPs? Option A, the State Board of Nursing. Option B, the American Nurses Credentialing Center, ANCC. Option C, the FBI. Option D, the local university. The correct answer is option B, the American Nurses Credentialing Center, ANCC. The ANCC is the primary body that grants the PMHNP-BC credential after passing the exam.